Stephaun Wallace, he, him, his. I am from Los Angeles, currently live in Seattle. U.S. Army veteran. I'm an advocate. I'm an HIV researcher. I am a clinical professor. I am a concerned Black citizen. A lot of my energy is spent talking about HIV prevention, and primarily about the prevention of transmission and acquisition, right? Sort of the biological aspects of that. But at the core of me, and my writings, my talks, generally are focused on the human component, which I think is often missing from the conversation. HIV is a disease, but because of the conditions that facilitate and support the disease transmission acquisition, particularly in our communities, to me it's a human rights issue. If housing instability remains an issue, if income inequality remains an issue, if negative experiences engaging healthcare professionals remains an issue, if stigma, bias, and discrimination continue to permeate in our communities, those issues will exacerbate whatever the disease is. If we haven't addressed sort of these social determinants or these structural determinants, then we're going to find ourselves in another situation where we're having very similar conversations about how to end that epidemic. It feels to me that many of the people who are having the conversations around HIV in Black communities in this country are people who are LGBTQ identified or they're cisgendered women. For me, there's a noticeable absence of cisgender heterosexual Black men engaged in these conversations in a meaningful way. So I think we need to bridge gaps. I think we need to close loops, close ranks, and come together, because we won't be able to do this without everyone involved. There is a responsibility for us to own our health.